Good morning, good evening, good afternoon, wherever you are joining us from. I'd like to say welcome. Well, tonight we are coming to you live from the Key Hotel in Leesville, and you are watching the second edition of the Appreciation and Award Dinner happening right here tonight at the Golden Key Hotel in Leesville. My name is Angeline Noah, and tonight we gather here to recognize and celebrate the dedication, resilience, and selfless services of our health workers and institutions who continue to stand on the front lines of mental health care in Liberia and also the fight against drug and substance abuse across the country. So tonight, as the red carpet unfolds, I will be bringing you the voices of our health practitioners. They'll be telling us their stories, challenges, and all of the things they've been going through the journey of providing services to our country. So we have our very first guest here tonight. So Eddie, can you bring it closer to our guest? So how are you doing?
I am doing great. I'm doing great. Thank you for inviting me here on the red carpet.
Well, you look smart.
Thank you. Thank you.
What is your name? Introduce yourself a little bit.
My name is Yasa Ilama. I am a registered nurse here in Liberia, and I will be your MC tonight for this all-important event.
Okay, so we have the MC here. How do you feel being a part of this event tonight?
I feel great. I'm happy to be here. Matter of fact, I was imported from Grand Giga to be the MC for tonight. So it tells you how important this event is. Recognizing our health workers, recognizing our survivors, and just saying to them, thank you for all you do. It's very important. And that's why I'm here tonight to raise this occasion.
Okay, so we are concerned about your story because a lot of people believe that, you know, as a health worker, you gotta be in a hospital and you don't have other life apart from being in a hospital. A lot of people feel that way. So tell us a little about your life when you're not at the hospital. What are some of the things you do that you find exciting?
So let me tell you, talking all things mental health tonight, so I'll just go that route. So being a health worker, sometimes we miss out and just think we're not supposed to be out there. But because we're talking mental health tonight, self-care is very important to me as a health worker. So when I'm not working, I'm out in the salon doing my feet, doing my nails, giving myself the necessary care, or spending time with my son, because I love to spend time with my son. So for me, that's how I pay attention to my mental health as a health worker. So it's not just being in the hospital. I love being in the hospital, don't get me wrong. I love my patients, but guess what? I also look out for my mental health.
So there are challenging moments in everything that we do, right? So tell us, how did you feel motivated during challenging times?
As a health worker?
Of course.
So for me, I kept my eye on the bigger goal. That is one, I actually decided to be a nurse because I wanted to serve. And this is something that I grew up witnessing. I can tell you for a fact, I learned delivering before I went to nursing school because my mother is a midwife. So I grew up seeing this. It's a lifestyle for me. So whenever I'm challenged or I feel demotivated, I always think about my why. Why did I enter this field? Why I chose to do nursing? And that zeal, that push keeps me going.
Okay, tell us your motivation, your expectation for today's event.
Well, tonight, my expectation is just everybody being happy, everybody appreciating the fact that, yes, we are at a point in great night of dance, a great night of sharing stories, a great night of recognizing great people, eating good food, and drinking some wine. So thank you very much, and I'll see you later.
Okay, thank you very much. So we are still here at the Golden Key Hotel in Peaceville, and you are currently watching the appreciation and award dinner for our health practitioner, particularly mental health practitioner. We will have our next red carpet guest, and I'm anticipating, introducing and welcoming here the great Dr. Zia. And when I say Dr. Zia, a lot of us know who Dr. Zia is already. Okay, I like that. I swear, okay. So how you doing, Dr. Zia?
Well, I'm fine, thank you. I'm happy seeing all these wonderful faces. The people who actually do the work, it's good to have them in the room. Good evening, everybody.
Well, you look really smart today. I mean, always.
Well, you're smarter.
All right, thank you. So tell us a little about, your journey. I mean, in summary, tell us your journey, because you are one of the most talked about mental health experts in Nigeria. I know yesterday I was at that event where we launched the, 20, 21st, 2030, anti-drug national plan. And I saw a lot of people here talking about what you are good at doing. Tell us a little bit about your journey. How you got to where you are?
Well, I'm just an ordinary Liberian trying to contribute to Liberia, and wherever I find myself, I try to give the most. I believe that life is a stage, and so every time you're on the stage, you have to put up your best act, because your audience is watching, and when you're leaving the stage, they are either clapping for you, cheering you up, or they're either gearing you up. So you have to choose how your act, how your performance gets out there, so that at the end you're hoping that you made a great mark. But as a Liberian, I was born here, grew up here, attended school here, did most of my education here, had some external posting here and there in a few countries, but otherwise, I'm fully grown by Liberia.
What kept you motivated? I know in everything we have challenging moments, and there were times, you felt like, oh, I think, but what kept you motivated to keep thinking?
I would say my beginning kept me motivated. I started in a place that I was never comfortable with. My both parents were educated, both of them struggled to bring us up. During the course of the war, my siblings and I, very limited resources, chronic deprivation was what we had to deal with. So I felt that I did not belong, or I did not want to be in a place, and I do not certainly want my kids to be in a place. So I keep aspiring for the best that I can be, hoping to be better than where I started.
Okay, you are a mental health expert. Tell us one meaningful experience, that reminds you why mental health care is so important.
Well, initially, I had wanted to become an obstetrician and gynecologist, and I always tell this story. At the time, I thought about that because there was a problem, and all along I've heard that maternal mortality, newborn mortality was an issue. So all my journey through medical school, through undergraduate and medical school, was all about OBGYN. So I got to a point where something happened, and I thought it was just a divine turning point for me personally. And I got to that point that I realized that if I'm intentional about solving problems, then the issue of mental health and drug abuse was a prevailing problem, and that we didn't have many people. At the time, Professor Benjamin L. Harris was the only psychiatrist. So it became a turning point for me that today I believe it was all divine. And I'm here, and I'm inspired by people ahead of me, people who are working in this field of mental health, people like mental health clinicians, people like, addiction professionals, and people just trying to give what they can to solve the problem. So I'm inspired by the work they do, and finding myself in this position now is just an opportunity where I believe I can give as much as I can so that we advance the work of mental health.
A lot of people are, inspired by your work, what you do, including me, standing here today. But, like I said previously, everything there are challenging moments. We have someone out there who is already on the journey of becoming a mental health expert. being motivated by what you do, and experiencing challenges by one another. One piece of advice do you have for such person?
I believe that regardless of where you are, when you keep your eyes on the goal, you forget many of these distractions. So go for what you want, regardless of how difficult it is. And I will encourage many people to actually choose mental health because the brain is the most important organ of the body. So be that most important person taking care of the most important organ in the human body.
So finally, before you leave, you're going to bring down all these things, and you are here today with all these people here to support you. So tell me and our viewers, what is your expectation for tonight's event?
Well, I may be the brain, but my team is the heart. And the brain will not work if the heart had not supplied some blood. So I want to give it all for my team, my very dynamic and wonderful team, the mental health unit, mental health clinicians, mental health counseling coordinators, addiction professionals, social workers, clinical psychologists, psychiatric nurse. He's speaking really hard so I can hear his voice. He's the psychiatric nurse in the building. That's my man, I told. Just about everybody, the psychiatrists, just everyone who have been making this work possible. I just want to say thank you for all that you do, and I'm hopeful tonight that we can actually appreciate, the best way possible the immeasurable work that they continue to do. So thank you, and I look forward to a pleasant evening.
Okay, thank you very much. It was good having you on the carpet. So Antoine is next. Our only psychiatrist nurse.
Thank you, and thank you. Unfortunately, we have to end this red carpet session. We have to get started. Yes, and yes. So we can do another session of the red carpet after the real deal. But tonight we are here to honor some great people, and I think we should do them justice by starting this event. Once again, thank you very much, Dr. Zia and his team, for affording me this opportunity to serve as the MC for this program for the second time. I am the inaugural MC for this event. Last year I was the MC, and this year again I am the MC. It's an honor. I don't take this lightly. I'm happy. Thank you very much. And let's make this happen tonight. So, I'm Yasa Nlabla. Like I said, I am a registered nurse. I've worked in Liberia for over 10 years. And it's a pleasure being here tonight. Republic of Liberia, Ministry of Health, Second Mental Health Appreciation and Award Dinner. December 19, 2025 at Golden Key Hotel. So on our order event, we have meet and greet. I know we already did that, so we're not going back to doing any meet and greet anymore. So attempt 2 here, before we go further, we have to reference God. We have opening prayer by Dr. Germaine G. Getet, Executive Clinical Director, and I'm sorry tonight if I mispronounced your name. Please forgive me. Is Dr. Germaine in the house? Okay. Is Dr. Germaine in the house? Can we have a volunteer to pray for us tonight? We should be referencing God. All right, let's pray. Can we please stand so that we reference God? Let's pray. Our Lord and our God, we say thank you for bringing us tonight. Thank you for gathering us here to honor special people who sacrifice their own health to look after others. As we go along tonight, we thank you for understanding, we thank you for peace, we thank you for togetherness, and we thank you that everything we do here will bring glory and honor to your name. In Jesus' name. Amen. And have a seat. So we jump straight into this, and I will take welcome remarks and recognition of special guests. That will be done by Famata Williams Eames, Deputy Director, Mental Health Unit, Ministry of Health. Famata. Yeah, we're not talking for the women's sector.
Good evening to all. Good evening to all. Good evening. Are we not excited to be here tonight? Yes. I am very much excited to be here tonight, and I know that we all are excited. You are excited too there. So tonight is a special night. Tonight is the second mental health appreciation in the world dinner. We had one last year, and we appreciated some of our hard-working mental health practitioners and our service providers. And we are here again tonight. We said that we will continue to appreciate people because we want to give you your flyer so you can smell it. Eh? So we are here tonight to appreciate you. And I want to say thank you all for coming. I want to recognize the presence of our hard-working county coordinators. Let me see all the county coordinators in the house. I want to say you all are welcome. We recognize your presence, we recognize your hard work, and we are glad that you are here tonight. I also want to recognize the presence of our service providers. We have Sibirele Meni. We recognize your presence. MSF is here. We recognize your presence. We say thank you for coming. We also have, we got labs and we got BOFA. I mean, we got ACF and we got BOFA. So I know BOFA, we recognize ACF presence. We recognize your presence. We say thank you. You are represented here in work capacity. And I also want to recognize our powerful and I don't want to say hard-working partner who last time we learned that they were transitioning. Canada Center, we recognize your presence. We thank you for coming. And tonight, I hope you not continue the transition tonight. And we also want to recognize the presence of the WHO. The WHO, we say thank you so much. And all of our mental health practitioners, our addiction professionals, and everybody, our special guests, we say thank you, our mental health unit staff. Put your hands together for the mental health unit staff. I recognize your presence. I say thank you for the hard work. And as we have all come to celebrate tonight, today is a night of celebration. Let us all celebrate, let us meet and greet, and let us meet from here excited. And I also don't recognize the presence of Canada Center, but I want to also recognize the presence of my own sister at the back there, baby. And you see how we're getting in trouble. Samantha Thomas. Put your hands together for Samantha Thomas. Coordination for mental health services. We say welcome. You all are welcome. Thank you all for coming and to have a pleasant evening.
All right, thank you very much. Thank you very much, Mistress Enid. Can you hear me, guys? Hello? Yeah, sorry, this is on.
Thank you very much. So tonight, before we go further, you see behind, if you turn around and look behind you, you will see the bathroom there. Just in case you want to use the bathroom while you're here, just go right there. That's the bathroom at the back. We got wine on the table. We got juice on the table. Have fun tonight, but don't drink too much now. Because driving and drinking will also like crime, right? Or you get in trouble. So have fun tonight. But before we move forward, I want to recognize Dr. Zia Esteem tonight for launching the 5 years anti-drug action plan. Can we give it up for Dr. Zia Esteem? And the head of a department that can tell you in bits and pieces how he's going to tackle the crisis we have in Liberia. It says a lot. If you look at that thing or if you read through that thing, it tells you the fight is at the grassroots. We are fighting from all angles. We are tackling this thing from all angles. We're not just doing politics. We are doing empowerment. We are helping people recover and empowering. And Dr. Zia, thank you and hands up to you and your team. We appreciate you. Thank you. So next on our list, we have introduction of the program by Aaron F. Diba, Coordinator, Substance Use Disorder Services, Mental Health Unit. Please clap and welcome Aaron.
Good evening, everyone. Again, good evening, everyone. For the third time, good evening, everyone.
Good evening.
Indeed, we are grateful. We have come thus far to celebrate an event that is so remarkable to the mental health unit, mental health, and of course, the Republic of Liberia. We have it necessary every year to have an important event as such to appreciate our good people, our team members, people who are performing in the landscape of mental health in the country, and of course, to thank you for wonderful work that we are doing in Liberia. For our today's program, trust me, we are going to have some good stuff together. Starting with, again, appreciation of our team members around the country, from the mental health unit, through our addiction program around the country, and of course, extended to all of our county coordinators and other good performance in your mental health. We will also recognize important institutions in mental health that are providing valuable services to the people of Liberia. And of course, we'll listen to some speeches, we'll listen to some music, and of course, you'll listen to some other good happenings here as we have a wonderful time together. Now to go in with some words, again, we say thank you for coming. We appreciate you being here. Have a wonderful dinner with our team, and of course, celebrate with the mental health unit and mental health. Thank you.
Do we have the Mother of Light organization in the house? Mother of Light. Can you say Mother of Light? Let's hear it from Mother of Light. Can you please say? I know you don't want to, but can you please say Mother of Light? That's nice. I watched the video documentary that was shared by the Ministry of Health, and I was impressed. Thank you. Why was I impressed? I tell people, starting substance or starting with new substance is as easy as anything. But the recovery process is a journey. And I am thankful we have people helping our brothers and sisters recover. And not just recovery, but empowering them. When I listened to one of the beneficiaries of that program, he said, what my addiction did to me was, it gave me anger issue. And he said, Mother of Light, they're just helping, or they're not just helping me to recover, they are helping me to learn anger management. And not just to learn anger management, I'm also working with them as an ambassador to help others. Thank you so much to have something like this in Liberia that our brothers and sisters can look forward to. It says a lot. we are hoping these services can be expanded to have more people benefiting, because we are in a state of emergency. Thank you so much, Mother of Light. We appreciate you. So before we go further, I want to read a quote from an unknown person. I know a lot of times when we talk about mental health, people say, "Oh, I got my family dinner to go to. I kind of want to work. I cannot miss work." But we forget that our mental health, when we are not okay mentally, we cannot deliver. I usually tell people, what you don't have, you can't give. So this quote by an unknown person says, your mental health is more important than the meeting you missed, the family dinner you skipped, or the workout you didn't do. Real quick, I will recognize the presence of the diaspora in the room. Jackie just walked through the door. You are welcome. Thank you for gracing this program. The diaspora, thank you. So the next thing on our list, we have presentation of mental health 2025 achievement. This is the meat of this event. So quickly, I will call on Dr. Moses here to come out, and let's honor our heroes and sheroes in the room tonight. Please give it up for Dr. Zia.
Good evening, everyone. It's a pleasure to be here and to see you beautiful people. I want us to lighten up small. We're here to celebrate. This is not one of those times when you've come to know your fate in the HIV test room. And you've done the test and you're waiting for the technician to come and tell you what your result is. It's not one of those times. It's one of those times when you can actually do anything and get away with it. So please cheer up a little bit. Well, this evening, I would like to begin by extending once again my profound gratitude to the Ministry of Health. Let me start from up. And the Honorable Minister of Health, who has become the #1 mental health champion in Liberia. She has given, let's give it up for the Honorable Minister of Health. The Honorable Minister of Health has proven over the last 2 years to indeed be a mental health champion. She has supported the mental health unit unlimitedly and has provided a lot of opportunities and resources to enable us to do many of the things we continue to do. So I would like to say a very big thank you to the entire Ministry of Health, specifically the head of the entity, the Honorable Minister of Health, and all of the deputies and assistant ministers and the rest of the team. I'd like to also go down further to appreciate all other units of the Ministry of Health that continue to collaborate with the mental health unit in making the integration work possible. As the mental health unit, we work with multiple other units to achieve the things we have set out to achieve. Without these units, we wouldn't be able to. So I would like to also appreciate all other units within the Ministry of Health. I would like to come home to the mental health unit and appreciate our dynamic team that is actually run. That team is run, that team is organized, that team is kind of coordinated by our very dynamic Deputy Director of Mental Health Unit. So let us please give a round of applause to the Deputy Director of the Mental Health Unit. Councillor Mistress Mamata Williams-Innes. Beyond being the Deputy Director, she also is our legal advisor by extension. So every time we're about to do something wrong, she will give us the legal aspect of it to make sure that we are right. Thank you, and I'd like to say thank you to the rest of the team. You've all been very amazing team members. I would like to go beyond the mental health unit to the counties. The county mental health coordinators are indeed our actual implementers out. Centrally, the Ministry of Health is designed such that policies, guidelines, strategic plans, and all of that emanate from within the central ministry, but implementation actually lies with the county health systems. And the county mental health coordinator are our major collaborators, our major point persons to ensure that all these policies we have set out are actually implemented. So let us please give a big round of applause for our county mental health coordinator. The work we do will also not be possible without the multiple partners who collaborate with the Ministry of Health. So the Ministry of Health is a government entity, but it provides health services to the people of Liberia through the government's own healthcare delivery system, but also through public-private partnerships. So there are a lot of NGOs, a lot of civil society organizations, a lot of health institutions that actually collaborate with the Ministry of Health to ensure that services are delivered to the people of Liberia. So let us please give a big round of applause to all of those partners. Among those partners are others who provide exclusive mental health services, mental, neurological, and substance use disorder services, but there are others that specifically provide substance use disorder services from prevention to rehabilitation or treatment to reintegration. So, and as you know now, the heartbeat in the town is the drug abuse situation. So these people are actually the forerunner of the programs we have. So I'd like to particularly recognize all substance use disorder service providers in the building. Let us please give a round of applause. The individuals working with these entities who continue to provide care are the actual MVPs. Without their services, without their sacrifices, without everything that they put into the work, none of what we do will be possible. So this time, let's again give a bigger round of applause to all service providers in the house. We managed to achieve some things. We managed to achieve some milestones over the year. And we'll just give a snippet of that. We wouldn't go too detailed with all the different things, but in the major thematic areas along our specific objectives, we just want to highlight some of the things that stood up over the year. So usually when we do these presentations, we try to organize things based on our specific objectives. So specific objective number 1 has to do with capacity building and development of the workforce. Now, none of the things you do will be done if people do not have the skills, the technical knowledge and skills. So we've been able to continue building capacity over the years, dating way back, as far back as 2010, when the Carter Center started training mental health clinicians. But we continue to evolve, we continue to carry out the function of developing capacity further. And so over the year, we've been able to train some individuals, providing training such as addiction, treatment, prevention, and recovery trainings. We continue that. This year, we've been able to work with the UNODC to organize a number of trainings working with service providers in prevention, in treatment, in recovery, etc. So one of the major ones I would like to highlight is a training we call Strong Families. Now, Strong Families is a kind of training that teaches facilitators how to work with families to help to prevent drug abuse early among young children. And this is not one of the common things you see, but this is an evidence-based intervention that was recently adopted by the UNODC, and we're proud we're the first country in Africa to actually have this training done. And so we're very grateful. I think that is something big. Yeah, so with support of the UNODC, with funding from the International Narcotics and Law Enforcement Bureau of the U.S. State Department were able to do that training, among the many trainings that we did. So I'd like to highlight that. We have continued to provide what we call the Mental Health Gap Action Program training. It's a kind of training meant to train non-specialists to be able to provide mental health services in areas where you do not have specialists. So we continue to provide English gap training. Now beyond that, we've been able to provide opportunities and training through the Ministry of Health for some of our staff within the mental health unit. You know, when you manage the mental health unit or when you're within a mental health unit, you have a lot of administrative tasks other than just your clinical skills. And you know, we try to pick up all these skills, these managerial skills along the way. So we're proud that up to 3 of our staff were able to benefit specific training in procurement, in project management, and in M&E over the time. So that was something about capacity building that we're also proud of. We continue to integrate mental health with all other programs. So many of the programs that the Carter Center have been able to launch or to bring a pilot phase of it, including the integration of mental health and TB, the integration of the tropical diseases and mental health. All those programs, the mental health unit remains committed and continues to carry on those functions, all those integration efforts. Because when the partners come, actually they help us to strengthen our system. When they leave, the system should not collapse. That is the original intent of their support. So we try to build on those resources and everything that they've been able to do to continue integration work. The next specific objective has to do with data and research. So this year we've been able to achieve a number of things as it relates to research and data. We've been able to successfully revise the mental health register, which is a ledger to collect data. We've been able to not just do that, not just to revise, but we've been able to print a number of several hundred copies of that with support from the Carter Center and other partners. By providing that ledger, we're able to actually collect data at service delivery points. And those data actually inform decisions that we make at the Central Ministry of Health. So by doing that, we continue to strengthen mental health data. We are also developing, we started earlier this year, we're developing drug information system. Drug information system is more like a database. It's like a system where we're able to collect data from people doing prevention, people doing treatment, people doing recovery of drug use disorders. We're able to get the actual data so that we know what kind of drugs people are using in the country, how many people using, what is the age range, what are interventions available. So we're building a drug information system, again with support from the UNODC, and that is something we are also very proud of. This data we are building, we are going to convert as placed in the National Anti-Drug Action Plan. We are going to convert it into what we call the National Drug Observatory. It's going to be like our central hub of every data related to drug in this country. Whether on the side of smuggling, on the side of trafficking, on the side of dealing, as well as on the side of treatment and prevention. So that is going to be a central hub. We already have work being done to build this system that's ongoing. So we're also proud of that. Now, data is one of those areas we also struggle, as many of us know. Research data in Liberia is not as common. I'm glad to announce also that we have secured arrangement and agreements with 2 entities to conduct 2 major research projects early next year. So the first one is a national drug use survey. And this is one thing we always wanted to do. We want to know what is the drug situation in Liberia. So with funding from the INL and with implementation support from the UNODC, we are going to be doing the National Drug Use Survey early next year, hopefully in the first quarter. All arrangements are set, and we are just waiting to commence. With our advocacy also, we are glad to announce that another study has been secured with funding from the Boston Children's Hospital, which is the priority Teaching Hospital of Harvard University, we've been able to work with them, and we have arrangements secured that early next year we're going to be doing another study. The drug use survey is going to be more quantitative, telling all what the number is, what the drugs are, and all of that. But we are keen to understand what in Liberia is driving drug use among young people. So we're going to do a qualitative study early next year with the Boston Children's Hospital, their global health program, to determine what are the drivers of drug use disorder among young people in Liberia. So those two studies we already set, and my team, I know Eric is excited about that. We are already giving all the initial, support, all the data and everything we need to do the proposal. We've already collected all of that. So early next year, hopefully in the first quarter, we should have something up and running. The next thing has to do with policies and strategic plans. Now, we have been able to drive the mental health policy and strategic plan forward. Now, when you develop a policy and strategic plan, actually it takes time, it takes a lot of effort to complete it. So our team and predecessors have done a wonderful job by having the policy ready, and it was actually validated. But when we came, we had to review, and obviously because of some changes in priority, we were able to modify further the current mental health policy and strategic plan. And by doing that, we made it, what we wanted to be, considering current, period. And then we've been working assiduously, and kudos to our football person on policy and strategic plan, Pharmacist Joseph Quinn. He's been driving that process of ensuring that we complete the costing of that document. And with special support from the partners in health, we are close. We are what? 91%, Chief? We are 97%, except that. 97% close to finalizing the mental health policy and strategy, which is a major milestone for us. Alright? So that is something we're proud of, we're able to do this year. So early next year, we want to be done with it. Then, the biggest one that we are proud of to announce, and we'll put it on a policy and strategic plan, is the successful development of the multi-sectoral national anti-drug action plan, which is the first of its kind in Liberia, and is going to drive our fight against drug and substance abuse. So that is one thing that we're really, really proud of. We launched it yesterday officially. It wasn't just a plan that was launched, it was also fully costed. So we know how much money we need, for example, to do what we intend to do. And the copy, the soft copy is available online on the Ministry of Health page. You can find that. But also we have some hard copies that we distributed with some key partners, and we'll try to continue that distribution process. Good thing about it is when you go through the plan, you're going to see activity by activity what we hope to do. So our investors in the room, our partners in the room, and the people who bring in the money, you are actually able to grab that plan and choose what you are able to do for Liberia over the next 5 years, year by year. Then infrastructure. We've also been working to develop infrastructure. So we continue to expand wellness clinics and activate wellness units, giving the needed support. We have few wellness units in the country. Some of them have not been fully functional. We're able to fully activate those wellness units to ensure that structural, update and general support have been provided to keep the wellness clinics up. We've also been able to initiate renovation processes. One of the things that trouble Liberia is that we don't have a lot of infrastructure. So when we talk about fighting drug abuse, we struggle. Where do we take the people we want to treat? Where do we carry them? But with funding from the government of Liberia, we are, I think, 98-99% done with renovation of a major structure in Bensonville, in YATC, the New Agriculture Training Center, that used to be a T-bed facility. We have a female dormitory that should be able to house over 150 beneficiaries. That building is up to 98-99% complete. Our partners, the Ministry of Youth and Sports, have been, they own the facility, so in collaboration we've been renovating, and they are now just preparing the beds to go there, and very soon we will have that structure. Through partnership with the World Health Organization also, and with support coming through the the UN Secretary General's Peace Building Fund, WHO has initiated the renovation of one dormitory as well in Bensonville. The male dormitory that also has a capacity of close to 150 beds. Those buildings are actively being renovated, and within the next few weeks or months, we'll have those buildings fully ready for admission. That will be a major leap for us because we never had any rehabilitation center as a country for many, many years. So that is something we are proud of and would like to also share with you. Additionally, we were able to activate the LRRC facility in Johnsonville. We've been able to activate that facility. It was intended for returning refugees. Right now, refugees are not returning from outside. But the people we have in Liberia who are struggling with drug use tend to be internally displaced people somehow. So we have activated that facility, and as we speak, we have a number of them in treatment, which we just mentioned quickly. Next is the comprehensive substance use disorder intervention that we've launched. We continue to do a lot of work in prevention. We continue with school-based prevention. We continue with community-based prevention. All right. We continue with social media, mainstream media. We continue with every means possible to educate the public about drug abuse. And I'd like to give a particular recognition to our school mental health coordinator. That's Ms. Kowi Yelebo. She has been very, very strong. And one of the things being able to succeed with is to develop a school, not just a school, but to develop a manual to be used to prevent drug use in schools, but also out of school. So it's been simplified to the point that the 7th grader can understand the content. And that document, officially produced with support from the UNFPA through the Peace Building Fund, has been endorsed, it's been validated, is now ready to be integrated into the national school curriculum. So we're going to be teaching drug use prevention in our schools, which is something we're also proud of. Thank you all to you and your colleagues for all the work you've been able to do. We have also not just provided information about drug use prevention, but we have actively been treating people with drug use disorder. And this is one of the areas we lack as a country for a long time. Looking at the statistics right now, we treated over 1,000, we enrolled over 1,000 individuals in treatment over the last 2 years. And this year alone, we enrolled over 700 people actually in treatment. These people are being enrolled in the outpatient treatment program where they come to the clinic, we work with them, put them on schedule, and continue counseling sessions, preparing some of them who are supposed to go into rehab, and then continue working with those who can benefit from outpatient services. And then also we've been able to enroll a significant number of that into treatment as well. So we've been able to enroll over close to about 400 of them in the inpatient setting. And the Mother of Light is one of the partners. Let's give it up for the Mother of Light. As the NT says, the Mother of Light is the beacon of hope for anything close to evidence-based treatment in this country. Fortunately, we got the exposure sometime in 2022, I and 3 other Liberians. We traveled to Lebanon, we learned about the program, we brought back valuable information, valuable knowledge that we were able to sit down with our Liberian team to modify and conceptualize for Liberia. So now we have what is the evidence-based treatment program that we want for Liberia. So any entity, any organization that wants to provide drug use disorder treatment program, that is the intervention that we have enlisted to be used. So we'll continue working with both partners, using the Mother of Light facility and other facilities. The facility in Johnsonville, the LRRC facility, we currently have over 200 persons enrolled in treatment. The Mother of Light facility, we have about 51 individuals in treatment, but it's a pool. So some people are entering reintegration phase, some people are entering the rehabilitation phase in the inpatient program, whereas others are still in the outpatient program. But when you put all these numbers together, we are proud to announce that we provided treatment for over 1,000 people, and we continue with treatment. So on the side, finally on the side of mental health service coordination, we continue to have our coordination meetings. We continue to work with all partners, and I know Sister Barbara would have looked at me if she was in the building right now. But since we got this place, for some reason, and that reason is called transition, so there's a mental health technical coordinating committee, which is like a big decision-making body of the mental health program in Liberia, and we all meet as partners, as senior officials of the ministry, as program director, and all the other people. We always meet to discuss the agenda of mental health and how we can move it forward. So the Carter Center had graciously served for many, many years the host of our meetings. And not just providing the physical space, they always provided an incentive that made many people go to meeting. And that incentive was one very nice sandwich, a bottle of water, and a can of soft drink. And I can assure you that myself went to meeting because I was expecting to get that sandwich. Unfortunately, because of transition, they're wrapping up, and so the space is no longer available, the funding is no longer available, so we started looking elsewhere. We have neighbors. The Medicine Sans Frontières is a neighbor to the Ministry of Health, and it looks like we'll be visiting our neighbors more often. Yes, it looks that way. So I will just have you have a little chat with Mr. Benedict Dawson, so he tells you why it means to host the TCC meeting. Okay, so not to bore you with so much, I just want you to know that the mental health unit continues to put in the effort needed to advance mental health services. We remain committed to working with everyone, the partners, the service providers, just individuals who are really interested in pushing mental health forward. We are interested in working with you. The office is open. We are always looking forward to having you join us so that together we can push mental health ahead. So with this little overview, I'd like to say thank you for listening, and let the meeting continue.
Thank you. Let's be happy for Dr. We cannot stay here tonight and list all the achievements, because obviously we will not go home. And when I say we mean business, so make sure this thing we call this drug to leave, for the drug to leave our country, we need business. If you can recall, when Dalazia was speaking, you will know that we are not just fighting this thing one way. We are launching our bullets from every angle. So we send it so you pass so, we send it so you pass so, we send it so. So tell you we need business, because when the president told us that he's declaring a state of emergency on substance use disorders in Liberia, he meant business. And the Ministry of Health is not playing with this. Kudos to our honorable minister for being there, or for being the backbone of the mental health department fight against drug in this country. Thank you so much. Before we go to the next item, this is one of my favorite parts of this entire program. I want to talk a little bit about something. I know a representative from the diaspora is here, and she will throw more light on that, but I just want to say something. All of us in this room, we have a part to play when it comes to health in this country. So, the diaspora, the Liberian diaspora, this December decided to host something called the Health Sector Investment Forum. Somebody will say, what is this, or what is it you're talking about? The diaspora decided that we are no longer sitting back to watch, the Ministry of Health just do it alone. We want to come on board, we want to help. So this event will be held at the Ministerial Complex on Monday, the 22nd of December, and it starts at 8 a.m. to 4:30. There will be lots of different things going on. Panel discussions, just trying to understand what's happening in the country and how we can help, the Ministry of Health to improve the health sector of Liberia. We are inviting you, please come and attend this event, ask questions, and have your voice, add your voice to what we'll be saying. I have the flyers in my hand right here. You can scan the QR code here to just RSVP, to that event. As I said, she will say more about it. Not to bore you, let's move to the next item on this list. And that will be a spoken word by Ernest Wesey. I don't see the three-winner spoken word category. I can enjoy it. There's so much what she's talking. Ernest, you're welcome. Ernest, will not reach your Rwanda. Honestly, Ernest will not reach. Thank you.
Good evening. How's everyone doing? So this piece is titled, Can You Hear Me? So we're going to make this a little interactive where I'm going to say hello and you have to respond saying hi. Are we okay? So let's practice hello. Hi. Okay. Hello? Her voice came tired from the other side of the phone. Not loud, not crying, just heavy. I'm fine, she says. The most dangerous sentence we learn to perfect. In Liberia, we answer greetings before we answer pain. How are you doing? I'm fine. Even when the mind is breaking, hello. Hi. He sits in a room full of people, yet he feels alone. They call him strong. They don't see the nights where sleep refuses to come because memories won't keep quiet. Pray about it. They say, be strong, as if silence needs strength. Hello? Hi. A child stares at the chalkboard, but his thoughts are louder than the teacher. They say he's stubborn. They beat the behavior out of him instead of asking the mind what hurts. Mental health in Liberia does not announce itself. It whispers. And because it whispers, we ignore it. We call it attitude. We call it madness. We call it spirits. Anything but what it truly is. An illness that deserves care, but then someone answers the phone. Someone listens without judgment, without laughter, without shame. For the ones who stayed when resources were few, to the nurses who treated minds as gentle as bodies, to the advocates who spoke when stigma was louder than the truth, this is an appreciation. Because you heard the high behind the I'm fine. You recognized pain when it had no words. You chose to believe the mind matters. You see, mental health, as they say, is not a Western idea. It's a human one. It lives in our homes. It lives in our churches, our communities. And because of you, Liberia is learning to answer differently. So when the phone rings, when the voice sounds tired, when silence feels heavy, we no longer hang up. We listen, we care, and we heal. Hello? Hi. Yes, we hear you. Thank you.
very much, Honest. We appreciate it. Before we go to special remarks, DJ, won't you think there was some kind of music? That's from this DJ, can you tell us? Yeah, please come music for us and DJ before we go to remarks. DJ, are you ready? DJ. While DJ is preparing to play some music for us, we will have special remarks. Somebody say out here, can we just sit up for our icebreaker? We Mooney, can we please stand? Can we please? DJ,
DJ Slow, man.
we're not hiring a DJ just yet.